In the meantime, to health issues now, the Minister of Health, Professor Isaac Adewale, has confirmed that the death toll from the recent Lassa fever outbreak is now 40. According to him, the disease has also spread to 10 states since the last 6 weeks, when the first case was reported in November. The death toll represents over 43% of the 86 cases reported so far.
It is important that I notify the nation through you that in the last 6 weeks, Nigeria has been experiencing Lassa fever outbreak, which so far has affected 10 states in the country. The states affected include Bauchi, Nasarawa, Niger, Taraba, Kano, Rivers, Edo, Plateau, Gombe, and Oyo states. The total number so far reported is 86 and 40 deaths, with a mortality rate of 45%. Our laboratories have confirmed 22 cases so far, indicative of a new round trip of Lassa fever outbreak. In response to these reported outbreaks, the Federal Ministry of Health, under my leadership, has taken the following measures to curtail further spread and reduce mortality among those affected. 1, immediate release of adequate quantities of ribavirin, the specific antiviral drug for Lassa fever, to all the affected states for prompt and adequate treatment of cases.
Now, of the 40 reported casualties from the Lassa fever outbreak, 5 are confirmed to be from Taraba State in northeast Nigeria. The death toll in Taraba rose from 3 to 5 after 2 more people suspected to have contacted the disease died at the State Specialist Hospital in Jalingo, the state capital. Taraba State Commissioner for Health, Mr. Innocent Vakai, said 2 other suspected cases are responding to treatment.
This is the Federal Medical Center in Jalingo, Taraba State, where all suspected cases of Lassa fever are brought for treatment. Already, the state government has set up a quarantine center for those suspected to have the virus, an acute viral hemorrhagic fever caused by the Lassa virus transmitted to humans from rodents. The death toll has increased to 5 as 2 suspected cases died 2 days ago.
Some patients were brought from to the wards, and they were received and treatment were commenced, and there is a suspicion that there could be suspected cases of Lassa.
While 2 surviving suspects are still receiving treatment, residents have been advised to report any other suspected cases.
The 2 patients, to the best of my knowledge, they are responding to treatment, to the conventional drugs we use in treatment of Lassa fever. They are responding, and we hope they are going to make it. And the Nigerian Center for Disease Control in Abuja has also assisted us with drugs for the management of these cases.
People who develop symptoms like similar to malaria or typhoid or similar common ailments, if they take the initial remedies, whether anti-malarial or treatment for typhoid, and after 48 hours they have not seen any substantial improvement, they should immediately bring themselves for tests for further assessment by the medical team in the hospital.
The Commissioner for Health also insists that the cases they have are still suspected and they are waiting for the results to receive confirmation.
We have sent the samples since on Sunday, and our doctors are currently in Abuja. So any moment from now, we are likely to receive the outcome from the laboratory, which is likely to say either they are negative for Lassa fever, or they can give us a confirmation and say all the cases we are saying are positive for Lassa fever. So if they turn out to be positive, then we can make a categorical statement to say we have confirmed cases of Lassa fever in Taraba State.
As the state government awaits the results of the blood samples, it has intensified its campaign in educating the residents on the dangers and measures to adopt in preventing contamination.
Let's talk more now about the spread of Lassa fever. Joining me now is a public health physician, Dr. Adedoyin Ogunyemi. You're welcome to the news at 10.
Thank you for having me.
Now, we already know that Lassa fever, one of the main factors why it spread so much is the dry season. But how can the outbreak be curbed so that it prevents a further spread of the disease to more states?
Well, I think that we need to sensitize a lot more. And that's looking at sanitation now. Ideally, this should be ongoing where we don't have rubbish around here and there around the houses. But now that it's here with us, what we can do alongside making sure sanitation, personal hygiene, we should also make sure that we let people know, health workers know that Ebola, this is Lassa fever, just the same way we made quite some about Ebola, such that if you have fever, you're treating malaria, is not going, think Lassa fever. And then what we can also do is to make sure there's access to drug. So that means it's not the time where we're saying the drugs are not available in our health center, where can we get, and all of that. Let there be access. Let's know the phone numbers. The phone numbers have been released. Let's be able to call and have access so that people do not die from it.
What about specific hospitals or clinics where people can go to get help, for Lassa fever? Are there specific hospitals or clinics that the ministry has?
The general
designated?
hospitals,
Okay.
and then the Lagos State hospitals, and then primary healthcare centers. These are centers you can then be referred to. But we know a lot of people also go to the private facility. Studies show that almost 60% in Lagos would go to a private facility first. So everybody should be on their alert and should refer when they need to. Yeah.
Reports suggest 20% of those who contract the virus are likely to come down with severe symptoms. What makes a difference in the other 80% who may not have the common symptoms?
So it's mostly symptomless, and viral diseases sometimes can be like that, immunity. So some people are able to ward it off despite the fact that they come in contact with it. But others with poor immunity will still come down with the disease. And the case fatality, that's the people who die from it, really should be about 20%. But if we look at the statistics we have now, just a little over 80 cases, and then you already have almost 40 deaths now. So that's looking like 40-something, almost 50% case fatality, people that have died from it. And that means that we have not done very well in terms of catching it early and treating it.
I want to very quickly explore the area of immunity that you talked about very briefly. Food, even though that is one of the transporters. One of the means by which Lassa fever is spread. How can people improve their immunity so that even if they have these symptoms, their bodies can still fight?
General health promotion. So if we go back to the basics, immunity right from childhood, newborns, are well breastfed, older children under 5 have balanced diets, older people to have very balanced diets. What else helps immunity would have been vaccines. But unfortunately, vaccines are not available for Lassa fever just yet. That's in the pipeline. And so we don't have that yet. So we still have to fall back to proper sanitation, less overcrowding, less slums. And when we look at all these basic things, we'll see that it will not only be taking care of Lassa fever, we'll be taking care of a whole range of illnesses that still bother us here in Nigeria and other rural areas.
Dr. Adedoyin Ogunyemi, thank you so much for joining us on the News at 10.
You're welcome.